Hello everyone, my name is Jack and I'm here to share more about conquering heart disease. So what is heart disease and what causes heart disease? In simple terms, heart disease is caused by a blockage in the veins or arteries where the blood flow is limited. Now the question is, what causes this limitation or blockage of blood flow? It's when there are buildup in the veins. Sharing with you the view of what is actually happening in the heart. But before I do that, I want to share with you some statistics, how we're doing, and what can we change this in Canada when it comes to heart diseases. About 45% of all non-communicable disease death worldwide are due to heart disease. That's a big number. Now, how are we doing in Canada?
All the arteries in our body consist of three distinct layers. The outermost of these layers is called the adventitia, a fibrous layer that holds the vessel together. Inside of the adventitia is the media, and the media is a muscular layer that allows the vessel to open and close on demand. As you require more blood flow to your calves while you walk, the vessel can open up and supply that necessary blood flow. Inside of that is the intima, one cell-thick layer that protects the entire vessel. Because of our diets and our smoking, we can end up with trauma to that intimal layer, which the body tries to heal, and that provides a fatty streak, which you can actually see in relatively young age. It begins right after childhood. Repeated injuries, you get an atheroma or a plaque, which narrows the vessel and prevents it from opening and closing normally. If that gets bad enough, you can actually clot off the vessel and form a thrombus and completely block the main blood flow to whatever end organ it is. If that's the head, you'll end up with a stroke. If it's the coronary arteries, you'll end up with a heart attack. Hopefully the first presentation is blocking the vessels to the legs and you end up with claudication or pain when you walk, to clue in your physicians and yourself that there is a problem with your vessels that we need to go in and fix.
As the image was illustrating, that's exactly what happens whenever there's a blockage of blood flow. If it's in the head, it's stroke. If it's in the heart or around the arteries, major arteries, it's heart attack, and then going downwards. In Canada, there's so much statistics. Obviously, there's so many things going on when it comes to the heart and the diseases, how it affects men versus how it affects women. The most important thing today that I can do, it's not necessary to mention all these interesting statistics, because everyone is having a bigger question is, what can I do to prevent this disease, and how fast can I start implementing these principles of health? So as I did mention earlier on, lifestyle is a key factor in the 7 principles, and I promised I was going to give 8 principles. The major principle here really that I'm discussing: exercise, proper diet, rest, and I'll be talking about the other because they all have importance, but the major part when it comes to heart disease, diet and exercise. So there is heart disease, and then when the rupture happens, that's when we have the stroke. That's when we have the bigger problem. So what can I do when it comes to the lifestyle, right? So eating a plant-based diet, it's much more helpful as it has 0 cholesterol. So what usually plugs the veins or the arteries, the presence of high cholesterol. So these cholesterols, which actually comes from sugars that are changed and kept in the body, or from the actual fats that we eat, they tend to go and just sit in the veins. So these things are the ones that usually in the long run after that causes a bigger problem. Now, to resolve that, if we change our lifestyle to a plant-based diet, we will not only stop the growth of these in our veins, but it can be reversed. There were studies showing how animals that were being fed high cholesterol and then they changed their diet, there was a complete reverse, not just animal, but also people who participated in other studies when it came to diet in comparison, looking at diet and the effect it has on plaque buildup and heart diseases. The result was amazing. So these are some of the things that we can consider when it comes to food. We need to know that most of animal products, they all have cholesterol in it, versus fruits, vegetables, grains, and nuts contain zero cholesterol. That's a plus when we're thinking of things that can help us prevent from heart attack, and which obviously come as a result of plaque building up in our veins and arteries. As you can see there, grains, fruits, nuts, and vegetables, they have zero cholesterol. But every animal product, animals and fish, they all have high cholesterol. And especially eggs, as you can see, it has high level of cholesterol, which is a bigger problem. And I'm really advocating, if we can, if possible, reduce or cut off some of this food, as in as much as people think that plant-based diet, it's not enough. Actually, it's enough. It's been proven. And most people believe that animal protein, animal food is very essential for your survival, which is actually not the truth if you look at the proper research. And yeah, that's the thing. So some foods containing harmful cholesterol byproducts are custard mixture, pancake mixes, and lard, and all these type of cheeses. So it says here, especially harmful are the custard and the pudding, with which milk, eggs, and sugar are the chief ingredients. These use of milk and sugar together should be avoided. So when you combine this thing, it creates something that's not healthy. We can calculate how much cholesterol we have in our bloodstream using this formula. The change of the intake of saturated fats subtracted by the polyunsaturated fats and added to the change of the total cholesterol square root. Obviously, you don't need to use this formula. All you can do is you can go to the hospital. They can help you find out how much fat you have. As a thumb of rule, if you start using plant-based diet and you implement things like exercise, sleeping early, drinking enough water, the plaque that was building up will slowly to decrease to an extent that you won't be affected much. Showing the ratios between these polysaturated versus saturated fats. As you can see here, the higher the ratio, the better. The lesser, the worse. If you can see here, fish are about 1.8, walnut and black walnut, very good. However, even plants, coconut tends to be not the best as it has the lowest. We can reduce the amount of coconut, but considering the other side effects of meat product, it's better to looking at whole food, plant-based diet for sources of these proper ratios of fats. Nuts can reduce heart diseases. This is a study that was done, and the results were almonds are preferable than peanuts. There's so many different nuts, but if you can apply it to your life, say every day or every other day, you take about a handful of walnuts or almonds, especially almonds, it will be very helpful. There's so many things that I could discuss about, but time is not on my side. However, it's very important for us to keep in mind that heart disease is something that if we think about it and we understand that actually it comes as a result of our own choices over time, we can then decide and say, you know what, I'm deciding to change my lifestyle. So just as we have sometimes plaque in our teeth, that's the same thing when it comes to heart disease. The plaque will take time. You go for cleaning, checkup every now and then, which is why it's important that when we change our lifestyle to understand that this takes some time to clean up the plaque that has been building up in our bodies. It's not something that you do today and then things change today. Same thing with the teeth and all that. So this is very amazing, helpful. I hope you find value in this. And again, there are some other things that we recommend that you take if you choose to go this route of vegetables. It would be awesome if you can get some levels of vitamin B12. You can get that from cereals, fortified soy milk, fortified rice milk, and supplements and all that, I do recommend getting enough levels of B12. And HDL cholesterol, lower risk. So things like exercise, drugs, specific thing, stopping smoking help, especially in lowering the, think of what you can implement in your life, whether it be running, jogging, brisk walking, and also try to reduce things like drugs that can inhibit the reduction of cholesterol and make it very hard for you. So things like alcohol, you can also think of how to reduce that if you tend to use alcohol. And some foods that you may think of including in your diet, things like onion and all that, they are very helpful. This is very good. As we can see, there's also some other things. For example, 7 steps to lowering your triglyceride. What is triglyceride? Triglyceride, the type of fats that are found in your blood. And they come in 2 ways. One, they come from the actual fats we eat. Another, they come from excess sugar that we do eat. The way we can reduce these fats is by doing the following: working hard to lose weight, exercising, eating less fats, decreasing stress, stopping smoking, abstaining from alcohol, and avoiding sugars. And after we do that, there's so much things that we can do to help, but with the better understanding of how in the first place triglycerides came to us, it's very important. So here they were comparing about people who got 10 to 25% of calories from added sugar. We're talking about added sugar in the food, and they were more likely to die of cardiovascular disease during that time. However, those who got more than 25% of calories from added sugar, they were more than twice as likely to die of cardiovascular diseases. Most people believe that sugar is just linked to the aspect of tooth decay, but actually sugar has so much to do with heart disease. Another thing I want to discuss whenever there's heart disease issues, we hear of bypass surgery, whereby they bypass a vein or artery to make up for that has happened. There are some advantages with it. It's because it's obviously life-saving and it's very helpful. However, some disadvantages with it are the following: is that it provides a temporary fix. So if you're relying on bypass surgery, it does not correct the underlying problem. And the other thing is it may have permanent side effects and it's expensive. So why can't we focus on the aspect of treating the problem other than treating the symptoms? It's very important for us to think, instead of asking, how can I turn off or stop this pain, ask ourselves, why is this pain here? And then from the results of whatever that's happening, which is the symptoms, go step by step, asking yourself to find out exactly the root cause and fixing it. That's super, super important when it comes to health. So you cannot help a man permanently by doing for them what they could do and should not for themselves. So the reason why I'm giving out this information is because I understand so many people are dealing with so many health-related problems, but they just don't know exactly how they can go about that. I'm trying to just help by giving information. I cannot really help you decide to choose or change your lifestyle. But if I give you information, it's going to be pivotal to your growth when it comes to your health. So at Nihaniao Health, the aim is not really to change you. The aim is to give information and empowering you to be able to make those type of life-changing decisions for better health. And when you are healthy, you are wealthy, because the most expensive gift you have from God is your health. And you being able to take care of it, vital and very helpful for not only you, but for your family and people around you. So there's so much things I could share, but my time is going really fast. Let me see if I did discuss everything. I discussed what is heart disease, what really causes heart diseases, and some of the food that we can reduce, some of the food we can increase in our diet to reduce the problem of heart disease. I did discuss that. Let's see if there is any other thing. I'm going to add this thing. It's that lifestyle. It's the aspect of lifestyle that I'm actually sharing, is that lowering fats, vegetarian diet, it does lower the fats. stress management training. It's very important if you are dealing with stress. Learn how to deal with stress in a more efficient way. Stopping of smoking and moderate exercise. It's very important for us to be able to do that. And social emotional support is also important when it comes to these type of issues. I do not know if there is any other thing that I left out. I'm trying to be quick, but in as much as we talked about that, I do want to hear your question. If you do have a question or your thoughts on this, do you like it? Is it helpful? And if it was helpful, what decision have you made to change in your life as a result of this, as a result of you watching this? Thank you so much, and may God bless you. See you next time. As today, I just discussed more about taking it easy with the heart and conquering the heart disease. There's so much I could discuss, but if you want one-on-one interaction with me or one-on-one gaining knowledge about these things or any other different disease from a lifestyle perspective, then please don't hesitate. You can reach out to me through the website, Nyaniao Health. Find out so much about Nyaniao Health, what's going on. And as I promised, stay tuned because I'll explain to you what does Nyaniao Health stand for. What are the principles behind Nyaniao Health? Thank you so much, and may God bless you.